you're all very much very heartfelt welcome to attending this briefing. Great you're all there. So the topic is the Enhanced EU Disability Strategy 2026-2030. Yeah. So the background, why is it an enhanced strategy? It is the second part of the EU disability strategy, which is the main framework or multi-annual plan. You could put it like this, of most things the EU is doing on disability within this 9-year framework. In your all initiatives, activities from the original document were completed in 2024. So that the strategy, of course, the strategy could not, let's say, the European Commission, the ones who work on disability, they could not just sit around for until 2030 doing nothing, just checking the emails. So some new initiatives, new activities were needed. Yes. And that is what the enhanced disability strategy is about. So they're proposing new initiatives and activities on many different topics, on digital accessibility and assistive technologies, on safe and accessible products and services, on mobility, on democratic participation, especially in elections, which is still a problem. Independent living and community-based services. So something was included we are of course happy about. Then jobs, social protection, housing, which is becoming a bigger topic now, education, healthcare, intersectionality, justice, legal protection and safety, preparedness and emergency management, cultural life, sport, travel and leisure, external action, humanitarian aid and enlargement, because this is supposed to be a briefing, to be short. We will not present every chapter in detail, because we don't want to give a university lecture, just an introduction. So we will focus on the chapters marked in green: digital accessibility and assistive technologies, independent living, housing, intersectionality, external action, humanitarian aid and enlargement. Yes, so I will start and present the flagship initiatives on independent living. Then Kamil is going to talk about assistive technologies and AI, Antonella about strategy and intersectionality, and Veronica about global action. First, a little bit additional background. So the first part of the disability strategy, when it comes to independent living, an important initiative was the guidance to member states on independent living, which came out in 2024. It was mostly guidelines on how to spend EU funds. We provided a lot of input to this. So we were happy to see that there was a clear recommendation in favor of personal assistance, personal budgets, and centers for independent living. Also other services, of course, also housing services for children, that sort of thing. However, these are not legally binding and also, largely ignored. That is my impression. So we were happy, of course, that we had some success with our input, but the long-term impact, I'm not so sure about. So now in the enhanced strategy, what are we getting? Like again, the positive side is that there's a flagship initiative, EU Alliance for Independent Living. And what does this mean? So the European Commission, they are, and I'm just presenting here what it says first. So the European Commission will encourage member states and stakeholders to exchange information, promote data collection and dissemination, raise awareness of factors that support or hinder AI. The initiative will include an alliance of policymakers and stakeholders to facilitate the creation of centers for independent living, monitoring the deinstitutionalization process, and providing a cost-benefit analysis, conducting an independent living implementation dialogue. Also, the Commission will encourage innovative solutions for independent living through EU funding. The Commission will promote community-based support in the European Social Fund Plus, in the European Regional Development Fund, in the framework of social services of excellence. So now to evaluate, is this useful? Well, I'm not so sure about this. First, the terminology is very extremely vague. So we have verbs like encourage, facilitate, or promote, which can be translated as we will do activities, but we are not responsible for results. At the same time, we have nice nouns like alliances, stakeholders, okay, monitoring is a verb, I'm sorry, implementation dialogues, and innovative solutions. And the question is, what does it all mean? What exactly will the alliance do? Who is a stakeholder in this context? Is it us, somebody else? We don't know. What exactly is an implementation dialogue? What will happen there? And also what counts as an innovative solution? So it sounds exactly as it seems, basically a lot of buzzwords merged together. What it means, what will it mean, we cannot say, because the information is not there. They left it at that. Then second, it's a bit a case of too little, too late. They're talking about the multi-annual financial framework, which is the long-term EU budget, European Social Fund Plus, and the Regional Development Fund, which are responsible for the bulk of spending on disability services. It's true. But for example, the ESF and the ERDF, they will be merged and lose their independence. So yeah, it doesn't even really make sense anymore to approach it from this perspective. Then disability has little to no influence over the negotiations at the moment. So yeah, there's the big question how they intend to do that, to have any influence about what the spending will be like, because it has not worked at all so far. Yeah, and there's a real risk that the spending on institutions will go up. Then the framework of social services. This is something similar to this guidance of independent living. Yeah, like it says, a collection of guidelines, but it's already 2 years late now, and it also will be not binding, and honestly, very unlikely to have an impact. So of course, because yeah, this critical assessment leads to the next question: what is ENIL doing now? We have sent an open letter to the Commissioner for Equality, Angela Bibb. Well, we are critical, but we also wanted to be productive, constructive criticism. So we're proposing a pilot project that leads to the creation of centers for independent living, personal assistance, and personal budget schemes, because what we are very worried about, because it's also vague, technically you could get away with having like a 2-hour event, having a bit, sharing some so-called good practice examples, and everything, and then you could claim you have done your implementation dialogue, tick the box, done. But yeah, we're doing good practice example exchanges all the time, even though the examples are not really good. But this has everybody comes, listens, and goes home. and this doesn't really have any effect. So we need some concrete outcomes. It should be underpinned with funding and ideally also led by us. Christoph is raising his hand, but I've already done with my part, and I will hand over to Kamil now, the Assistive Technologies and AI. There will be time for questions at the end. So, Kamil, I will stop my presentation now and let you share the screen.
Thank you, Florian. As always, very interesting. Yes, let me share my screen. You need to give me hosting rights.
Okay. One moment.
Yes.
Where I'm in the list, I found you. So.
Okay, good. Let me share. If it doesn't work for some reason, let me know. I will make full screen, and then I need someone to tell me if you can see if it's changing slides or not. So, do you see if I change?
Yes, but you need to go into presentation mode still.
I have it in presentation mode. No?
Um,
Let me share. Let me do it again. Let me reshare. Sorry. This new Zoom changes always confuse me. So I will stop sharing and share again. And hopefully this time it will work. Now is it presentation mode?
Yes.
Yeah,
And if I change?
Yes.
it works.
Good, thank you.
Yeah.
So hello everyone. I don't see the clock now because I have the full screen. So I will ask one of my colleagues to let me know if I'm close to 10 minutes. I will try to be faster. Florian or Christos, you can raise your hand virtually and I will see it because I can see you on the side of the screen. So that will be the sign. Hello everyone. Thank you for joining us. My name is Kamil Gungor. I am working for ENILA's Policy and Movement Support Officer. And among other things, I am the one working a bit more on assistive technology, AI, and how these things impact disabled people and especially independent living. Today, we will see a bit these perspectives from the strategy perspective and how it includes or not the whole discussion. I assume you could guess already that AI is included in the strategy and technology in general, assistive technology, but AI a bit more. AI is a very sexy topic this period in Europe and in general. So, of course, the European Commission would discuss it and in different levels, as we will see. So, in the strategy, technology, that AI offers new opportunities for disabled people. And the Commission recognizes that it can increase accessibility. Of course, it can support autonomy and participation of people in the society if you have the right tools, that it can improve quality of life in different ways. I will explain very quickly soon. And in general, it can enhance participation in the different phases of life, from political life to whatever. But also, there is a mention that AI must also protect fundamental rights and avoid discrimination. There is a mention, like a general one. However, it's not very strong. It could be much stronger mention on the biases of these technologies and on how these tools and technologies may discriminate against disabled people or work contrary to our autonomy and independent living. For example, if it is used also for institutionalization, then this is not a good use of AI. And there is no mention about bad uses of AI. So, and technology. So that's something we could have a bit more strongly addressed. Here there is a slide that I made, and just a few ideas of how AI and assistive technology can support independent living. This is not coming from the strategy, even though some of these points are in the strategy, but from the general experience. The point is to get an idea that AI and technology today play a role in our everyday life. And I mean, a basic role, we do everything with it. And I don't know how many of you remember living without AI and assistive technology devices. I am a bit old, so I had a few of those years. I don't know if today it's more interesting or not, but I know that today, thanks to all these developments, we can get support in communicating. You know, there is devices for people to communicate in different formats. I mean, you remember, for example, Stephen Hawking using even an old-fashioned computer to communicate. Today, it is much easier. It is easier to make a decision and to get information, to access information. These two are kind of interlinked. It is easier to participate in work and in education. We use technology now. We also have captioning in this Zoom for people, AI-generated captioning for people that want to follow the session. So, participation is supported by this kind of technologies. Managing our daily activities, of course, from, I don't know, the robo vacuum in my house to turn off and turn on the air condition, the lights and windows and doors for some smartphones. And I mean, Spotify, YouTube recommendation, all this can be also AI influenced. And of course, to navigate environments for people with different impairments, visual impaired, and not only, it can help you to navigate, to tell you what is in front of you, to be careful because I don't know, something is coming. So, I mean, AI is everywhere. And of course, since it is everywhere and we need it for our independent living, I mean, I could put another bubble to say that it can also contribute to independent living per se, like instead of a human, like assistant. But this is still under development. It is coming. I don't think it will replace people. It will support people to provide support to disabled people. But this is another discussion. But since we have this discussion, of course, Commission needed to address it, of course, because it is very real in our life. So we added it in the strategy. And in the beginning, it mentions a few legislations where on accessibility and digital services, when technology and AI are relevant. I will not analyze all these strategies. You are welcome to Google all of them and to find information. All of them are related in one way or another to AI, assistive technology, and stuff like that. But for example, there is this Artificial Intelligence Act. We wanted, to address the disability perspective, and it does, but not maybe to the extent we would like to. The European Accessibility Act, which is basically at the moment, I mean, some people you will hear mention it as a success, some mention it as a disappointment. The point is that it is working a lot on technology and on the cloud, but not in the physical environment. So for the discussion at the moment, and since we discussed technology and AI, European Accessibility Act is relevant and it can influence and support. Of course, I mean, it's not enough. There is still ways to move forward. There is the Web Accessibility Directive, Digital Services Act. So a lot of this kind of digital stuff, which of course are related also to disability. There is mentions about accessibility. Not in the strategy, you need to read the acts and the directives separately. But in the strategy, you will see these are acts mentioned. The Audiovisual Media Services Directive, so for TV and other media, and how this can be accessible, and AI, how can it be used for, I don't know, subtitles and all these kind of things, and for communication. And of course, the Accessible EU, which are put a little bit separate, because Accessible EU is a general scheme that covers pretty much all the accessibility issues, not only on technology and AI, but it is relevant also here. Then there is this flagship initiative, assistive technology and AI from lab to market. In this green box, I put the whole initiative the way it is written in the strategy. I will not read the whole thing because of time, and because, I mean, if you want to read the whole strategy word by word and sentence by sentence, you are free to do it. We are here to summarize it for you. But basically, European Commission recognizes that assistive technology and AI are not reaching the consumers and the market as easily as it should. So it takes some initiatives, and they want to strengthen the European market. They want to connect users, technology companies, and public authorities together, and to involve all of them, in the discussion about AI and how can it be used in the market. They want to remove barriers to access, so accessibility here plays a role. And of course, it is always important because you can have a technology, if it's not accessible, it's useless for us. Affordability is always an issue, and it is also discussed to some extent here. We need it to be affordable because, if I need to buy a device and it costs a few €1,000, and then we have a problem. Disabled people, we know they are usually on the side of the economic power in the society. So most of the times we are not very rich, but our services and the things we use cost a lot, which is an interesting paradox for another webinar. So affordability is mentioned. And of course, there is a mention to support innovation and, and also involvement of disabled people in that. So we could develop technologies and co-produce technologies together in the framework of nothing about us without us, they say. I would say nothing without us in general, which is the new way of saying the same thing. But I mean, it's broader because everything is about us. It could be stronger. It could mention a few more things, but it's still, a good initiative, I think. And I think I know I am, with the time, I am probably overusing it. So I think that's my last slide, or the one before the end. So one more thing, when you read the strategy, you can see that a part of the specific chapter, which I more or less analyzed, AI and technology is mentioned also in different aspects, from also some of the ones Florian mentioned. You hear mention of AI in the use of business. How can you help businesses, get into technology and, modernize and support customers, but also in an accessible way. In deployment, there is quite a few mentions about, support for disabled people with the use of AI and technology, with deployment, equality directive, disability, employment package. These are things mentioned in the strategy. Employment is important for the strategy, in line with the technology and AI. In education, and the last, but it's interesting for me, it's in its own services. So it says, and I will read it exactly the way it says, I quote exactly the text from the Commission, that furthermore, the Commission will present a digital accessibility action plan 2026-2030, covering its entire digital ecosystem. It will also continue to implement the infrastructure and buildings equality work plan. Okay, and some dates: increasing awareness of physical accessibility among staff and the relevant professionals, and the Commission will aim at making meetings and events held in Commission conference room more accessible across all EU languages, and deploy AI-based multilingual services. So we see here that Commission wants to make her work more inclusive, at least to some extent, using technology and AI to make it multilingual, to make it probably maybe easy to read, plain text. It's not very clear what it means, but it seems that technology will play a role even for EU itself to become more friendly and accessible to the people and to the community. I think that was it. I tried to keep it in the 10 times. We could have a 2-hour discussion only about this topic, equally as all the other topics today. But yeah, we are here to give you the first food for thought, and then we can continue the discussion anytime you want. Thank you very much. I give the floor back to Florian, and I am available for questions later.
Thanks, Carmel, for this very interesting presentation. And I hand over to Antonella to talk about intersectionality.
Hi, everyone. Thank you, Florian. I'm going to share my presentation. I want this. Okay. Okay, I will be focusing on this strategy from a more intersectional perspective, as my colleague Florian mentioned. So just very quickly, to remind what intersectionality is, our identities overlap and systems of inequality do the same. So basically, intersectionality is the idea that different aspects of someone's identity combine among each other to create unique experiences of privilege and discrimination. The key idea, it's not just one identity, it's how all these identities intersect. For example, race, ethnicity, gender, sexual orientation, age, disability, and socioeconomic status, and many other identities that the individual might have. For instance, a Black woman with a disability may face very different challenges than a Black man or a white woman without a disability, because all these systems intersect: sexism, racism, ableism, and classism. When it comes to the strategy and intersectionality, there is a paragraph. Oh, what's happening? Okay. There is a paragraph specifically dedicated to disability at the intersection. But who is changing? I don't know. Is someone change? Okay, I don't know. I will try again. Sorry for the technical issue. The slides are changing automatically. So, two questions, but maybe in the meantime, I ask my colleague to have my presentation there in case this repeats again. So maybe you can share. So two questions raised. So what does this strategy do well in terms of intersectionality, and what is missing or raise some concerns? When it comes to the strands, do you want me to? Yes, please. I will stop sharing my screen. And my colleague Veronica is trying to see.
AI is taking over.
What?
AI is taking over.
Yes.
I can share your presentation now if you want to.
Oh, I think Veronica is doing that.
Okay, don't worry.
Right.
Thank you.
It doesn't move, right?
Mm-hmm.
Sorry, I can do it again.
Slideshow.
Is it moving? Why? Wait.
Okay. Apologies for the technical difficulties. What's wrong?
Doesn't
Veronica is trying to share the screen, but I think it's not working.
it's
Yeah.
not
We can see
it's
your
not
screen.
moving. Yes, but it's for some reason it doesn't move.
Can you, Florian, try from your
Okay.
end?
Okay, I will try.
Thank you.
Please, yeah, you need to terminate the screen sharing, Veronica.
Yes.
One moment. I need to open it.
No
too.
rush. We can relax a bit, take a break, read the comments in the chat. It's nice to see all these participants from all over the world.
Very good. You're soothing us. Okay.
One way to do it maybe is first to make it full screen and then to share it. At least for me, this is how it worked.
Yes. No, Zoom is
How can you do that?
easing me now a little bit.
But then it's an issue if it's not. Okay.
One moment, I'm just. So, where were you?
Yes, strengths. Yes. Okay. So in the next slides, we are going to identify some positive and negative aspects related to how intersectionality is implemented in the strategy. Among these trends, there's first of all the recognition of multiple discrimination. So the strategy clearly recognizes that persons with disability may experience multiple and overlapping forms of discrimination. The second element is inclusive identification of diverse groups, in the sense that it explicitly acknowledges groups that are often overlooked in policy, including women, children, older people, queer people, and racial or ethnic minorities with disabilities. Next slide, please. There is also a focus on key areas of inequalities, for instance, access to healthcare, sexual and reproductive rights, and violence against disabled women. Also, the strategy promotes policy coordination by linking disability to broader equality, for instance, the anti-racism and LGBTIQ+ strategies. And finally, the commitment to evidence collection. There is a commitment to collecting evidence and improving the understanding of inequalities. Next slide, please. There are also some gaps and concerns in relation to intersectionality in the strategy. For instance, the section I linked in the previous slides emphasizes studies, research, cooperation, but provides very few concrete policy commitments and initiatives, or also enforcement mechanism and accountability measure to address intersectional discrimination. And as Florian said at the beginning, the language is very, very vague. Second, there is uneven attention to intersectional groups. So it is true that the text acknowledges multiple forms of discrimination affecting the different groups, but the proposed actions focus more on gender and the intersection between gender and disabilities. But other groups, for instance, LGBTIQ+ people, racial or ethnic minorities, also older people, children, migrants, and the refugees with disability receive very little attention in terms of policies. There is also the risk of tokenism, in the sense that the inclusion of intersectionality may remain more symbolic rather than being accompanied by concrete measures, and simply referencing disability within other equality strategy doesn't really guarantee meaningful inclusion or better outcomes. Next slide, please. There are some more concerns, like also the lack of disabled peoples in participation and leadership. Disabled people are more presented mainly as beneficiaries and recipients of policy interventions rather than active actors able to take a role in designing, implementing, monitoring, and evaluating the policies. And this is particularly true from underrepresented and marginalized community within the disability community. Also, another important point is the policy fragmentation. So by addressing intersectional disability issues through separate policy frameworks, for instance, the paragraph mentioned the gender equality strategy, and they refer to the anti-racism strategy and the LGBTIQ+ strategy. Doing this, responsibility may become dispersed across different initiatives, and as a consequence, this can weaken accountability and make it hard to address the experiences of people who experience intersectional forms of discrimination. Also, this is a very important point. Intersectionality is not mainstream across the whole strategy. We see there is a very short paragraph specifically dedicated to that. But intersectionality is still treated as a distinct topic rather than a cross-cutting principle. And an intersectional perspective should be integrated throughout all chapters and policy areas. For instance, employment, education, artificial intelligence, housing, and so on. And finally, the limited recognition of intersecting systems of inequality. The focus is more on identifying groups at risk there rather than seeing how we can promote structural changes and policies. Next slide, please. And specifically, if we look at the other policy areas, we can see intersectionality is missing in many of them, or more could have been proposed, especially in terms of initiatives. For instance, underemployment, intersectional discrimination against disabled women is mentioned, but there is very limited attention to race, ethnicity, migration status, or sexuality, and very few initiatives in this field, even if we know there is a big disability and gender gap. Same under AI, education, housing, and independent living. All these focus a lot on inclusion, accessibility, and affordability, but there is very limited attention and focus on the diverse experiences, such as of migrant refugees or also gender-based violence survivors with disabilities. Other two areas in the next slide, please. Okay, even under violence and access to justice, there are some gaps in the sense that there is a strong focus on protection of women with disabilities from violence, but they are also seen more as passive rather than active agents of change. So there is limited attention to initiatives related to empowerment, participation, and leadership, and issues like the accessibility of shelters, support services, legal aid, or broader intersectional forms of violence are not explicitly addressed. Also, I mentioned before the commitment to data collection. Go back, please. Thank you. It is true that the strategy commits to disability disaggregated data, but it doesn't really support intersectional data collection. And this is a very important aspect because it's how we reply to inequalities in terms of EU policies. Next slide, please. As my colleague did, I will also explain briefly what ENIL is doing from this aspect, so to promote intersectionality. ENIL is working intersectionally across its advocacy, project, and independent living work by recognizing the diverse experiences of disabled people and promoting the participation of underrepresented groups, especially for historical and cultural issues, as the European independent living movement was often led by white disabled people and specifically men. So we're trying to advance work on sexual and reproductive health and rights, freedom from violence, and especially community-based support services, but also developing practical resources like the recent toolkit on Center for Independent Living, which is a practical toolkit for user-led and intersectional support and advocacy. The Independent Living Pillars implementation report, and specifically the upcoming one on sexual and reproductive health and rights and independent living. ENIL is trying to support also community-based support and independent living and local initiatives. And a very important objective is to also strengthen the cross-disability representation. So ensuring that people with different impairments and support needs are equally represented in our work, advocacy, and leadership, and promoting also collaboration across the disability communities to address the shared and specific barriers. Next slide, please. So there is still much to learn and to do. For instance, to increase participation, engage more women, but also queer people and people with ethnic minorities, young disabled people, and create a safe space for sharing all these direct experiences of both privilege and discrimination. And build knowledge and capacity, so deliver training on intersectionality for staff, partners, membership, collecting also and sharing good practices from across Europe, but also beyond. And finally, strengthen representation, namely ensuring that diverse voices are represented and promoting the leadership and participation opportunities for underrepresented groups. There is also a new initiative going on. We're trying to build a new advisory board on intersectionality in our organization. This is an open call for all members of disability community. And the deadline is actually 23 of June, so pretty soon, but it's open and we invite everyone to apply. And you can also go to the next slide, please. And to become part of this advisory board. We will select around 4 or 5 members, and they will suggest us some activities and an action plan. I included a link in this slide, but I will also send in the chat if you want to contribute and engage with us. And thank you for listening me. No, not only for ENIL members. I saw the email in the chat question. It's open for everyone. That is the good thing. Also, we really encourage and try to have people from outside, external the organization.
Hey,
Thank you.
thanks, Antonella, and I'm handing over to Veronica. Veronica, do you want to see if you can share the presentation, your presentation? Okay. Now everything is breaking down.
Yes, sorry. Sorry, I'm here. So I send you my presentation through email, but I will try to share it if it works. First, maybe it works.
Yeah, that's what.
Yes, it works now. It's just if I start, it's not changing. How do you make it?
Shall I share the presentation?
Wait. I will try it once again. How do you make it that it,
Do you read the slideshow?
Oh.
this is
Yes.
and I can't share it now.
Yes. Is it you?
No, it's not me. I think it's
Okay.
Florian, it's you?
Yes, it's me.
Okay. Thank you. Thank you. Sorry for some reason it doesn't really work today. Okay, so nice to meet you everyone. My name is Veronika Kovac, and I will talk about how the EU disability strategy plans to promote the rights of persons with disabilities globally. Next slide, please. Next, okay. So first of all, the strategy acknowledges that disability rights cannot stop at the border of the European Union. Globally, more than 1 million people, or around 16% of the world's population, have some form of disability, and this is set to increase due to the global aging trend. Persons with disabilities are disproportionately affected by poverty, conflict, humanitarian crisis, barriers to education and employment, and institutionalization. This means that promoting disability rights internationally remains really essential to the EU if they want to fulfill commitments under the UN CRPD. Next slide, please. One of the important development highlighted in the EU in the disability strategy is the Annan-Berlin Declaration on the Global Disability Inclusion, which was adopted in 2025 Global Disability Unit. So the declaration calls on the government, international organizations, and donors to ensure that all development programs are inclusive and accessible for persons with disabilities, and introduces this principle of 50% for 50%. That means that all development programs should include 50% inclusively designed for persons with disabilities. So the logic behind is that the persons with disabilities are, like I said, 15 or 16% of the world's population, yet really significantly underrepresented in development cooperations. So today, around 6% of development's prospects contribute directly to disability inclusion. So therefore, disabled people are continued to be excluded from education programs. Infrastructure projects are often developed without accessibility requirements, and humanitarian responses frequently fail to reach people with disabilities. Next slide, please. Oh, yes. So this kind of explains this 15% for 50%. I basically just explained this in the moment. So yes, next slide, please. Yes, so the new strategy also commits to strengthening disability inclusion through its external action, which means promoting the implementation and the ratification of the UN CRPD, continuing cooperation with the UN CRPD committee, and mainstreaming disability in high-level dialogues with partner countries, strengthening disability focus in the EU Action Plan on Human Rights and Democracy. When it comes to inclusive investment and reconstruction, The strategy integrates disability inclusion into global gateway investments, promote accessibility in infrastructure projects, and ensure disability inclusion post-conflict reconstruction and recovery. And when it comes to independent living and the strategy promises to prevent EU funding from contributing to institutionalization and instead supporting community-based services and independent living, and promises to use the OECD Development Assistance Committee Disability Marker to track disability inclusive funded operations. Next slide, please. Yes, so the strategy also pays particular attention to humanitarian aid and acknowledges that people with disabilities are more vulnerable and part of the marginalized in humanitarian crisis. Disabled people are more likely to be excluded from both preparedness and crisis management initiatives, unfortunately. So it plans to building on the evaluation of the operational guidance on the inclusion of persons with disabilities in EU-funded humanitarian aid operations, strengthen disability inclusion in all EU-funded humanitarian operations, and promises that disability inclusion will also be reaffirmed throughout upcoming communication on EU humanitarian action in a shifting global order. Next slide, please. So when it comes to EU enlargement, which is also part of the strategy, it really focuses on the reconstruction of Ukraine and introduces this principle of nothing about us without us when it comes to Ukraine's reconstructions. So it promises that disability inclusive rebuilding will be support in Ukraine's reconstruction. For example, in a high-level event focusing on accessibility as part of one of Ukraine's reconstruction conferences in 2027, and the involvement of meaningful involvement of disability organizations and participation, and the implementation of the new European Bauhaus projects. The new European Bauhaus promises to be, when it comes to new builds or renovation, promises to be inclusive and sustainable. So basically the EU is, the strategy promises to support EU fundings to accessibility in reconstructions. And this is really important, particularly because over 3 million Ukrainians live with disabilities, including around 230,000 children. And since the full-scale invasion, an estimated 300,000 people have acquired a disability due to war-related injuries, and 1.8 million persons with disabilities require humanitarian assistance. Even before the war, Ukraine already had one of the highest rates of institutionalization in Europe. So during the war, making disabled people particularly vulnerable during evacuation plans and displacements. And today, around half of displaced household livings in collective shelters include an older person or a person with disabilities. Next slide, please. So I would also, because of this, would like to talk a little bit about preparedness and crisis. So the EU Commission recognizes that persons with disabilities are overlooked in emergency preparedness and crisis management, and is taking a step to make preparedness policies more inclusive. The new strategy acknowledges that disabled people face disproportionately risk during disasters, conflicts, and emergencies, and recognizes that emergency planning often fails to account for accessibility or communication needs or support requirements, and introduce this Prepared for Anything and Prepared for Everyone initiative that aims to embed disability inclusion into preparedness, crisis response, and civil protection policies. So the plan is to build a more resilient and inclusive society where preparedness measures are designed for everyone from the first start and not just later taken into consideration. Next slide, please. So what we would like to see at ENEL when it comes to preparedness and crisis management is one, really accessible emergency shelters for everyone, inclusive evacuation and emergency response plans, accessible early warnings and communication systems, training for first responders on disability inclusion, participation of persons with disabilities in preparedness planning, and the protection on independent living during crisis. Next slide, please. And for last, I would just briefly mention a few plans that we have for next year. So we would like to launch a consultation process with ENEL members to identify priorities when it comes to our external action plan, and then develop an independent living global agenda paper. And later on, we would present our recommendations through a stakeholder roundtable in the second part of 2027. Also monitor EU preparedness and crisis management initiatives and advocate for accessible shelters, inclusive emergency plans, and disability inclusive preparedness policies, like I just mentioned. And also monitoring disability inclusive reconstruction of Ukraine, advocate for accessibility and meaningful participation of disabled people, while also advocating for investment in community-based support, accessible and affordable housing, and ensure that EU funding does not contribute to institutionalization. And next slide, please. Yes, thank you so much for your attention. This is what I wanted to briefly tell you about the global point of view of the strategy.
Okay, thanks, Veronika. Now there is time for questions and remarks from the audience. Please raise your hand. We will then call you up.
Let's see also in the chat if there is anything.
There are some questions in the chat by Gafsa Garson.
Okay, do you want to read one or two?
So question number 1, the global and African perspective. While the updated EU disability strategy outlines excellent frameworks for regional compliance, disabled individuals globally face identical systemic barriers. As a qualified international clinical advocate, I want to emphasize that while Europe implements these measures, other continents, particularly the African continent, are battling these exact same struggles under entirely different resource realities. Given the strategy's stated global dimension, how will the European Commission ensure its external partnerships actively support ground-level accountability globally? And there are some more questions in specific. For example,
these are very long, complicated questions and statements. Can the people who raised them please take the floor and explain it short? Or somebody else can raise a question. I can't see the full participants somehow anymore. So I can't see who's raising their hand.
We have another question in the chat. How is the intersectional perspective addressed in external action?
I can reply in part, and then maybe Veronika has more expertise in external action. So the first thing we're trying to do is also like trying to collect good practices and examples, not limited to Europe, but also from other countries. For instance, on the report we are currently drafting on the implementation of independent living pillars. This year we will be focusing on sexual and reproductive health and rights, and we try to keep the consultation open to everyone, not only to INEL members. This way we can collect and hear from perspective from also other countries and cooperate more in this sense. Maybe Veronica has something more to add. That's just an example, but yeah.
Okay, I managed to figure out one of the longer questions. So the question is, how will member states be held accountable who financially and legally, if they do something not aligned with the UNCPD and so on and rights? How will the strategy do this? Not at all. That can be answered like this. There is no way at the moment that the EU will hold member states accountable for anything in the area of disability. It is emphasized repeatedly to us that the EU competences in the area of disability are very limited to guidelines and recommendations, non-voluntary measures. And while we have some directive and regulations on disability too. But we are in a situation where the EU level, the Commission in particular, has to pick its battles on what they enforce towards the member states, and they would not prioritize disability sufficiently enough to pick a fight with someone really. Okay. That's the answer.
We have another question in the chat by participant. So, how will international cooperation under the EU disability strategy support independent living in countries like Nepal, where systems are still developing? Family-based or informal care is still dominant, and there is a persistent gap between policy and implementation.
I can since I'm the I will since I had the independent living initiative, I will start with this. So this is at the moment very, very uncertain. There are no commitments at all about supporting, for example, CILs or personal assistance schemes. That is something we are pushing for in our work on the multi-annual financial framework. We are advocating there is the EU has the Global Europe program, which funds projects in all places who do not belong to the EU, also Asia. And we are pushing to have independent living, to have Global Europe also support independent living, yes. Yeah, we are in a very difficult situation. It's the first time INEL is really reaching out to MEPs who do not specialize in disability and who work on global issues really, and also to national governments. We have done little outreach on this in the past. So these people are now wondering who the hell we are and why we are bothering them. So it will take a bit while for us to make ourselves a name there. And I think in the current round of the MFF negotiations, I don't think we will achieve much. Probably only in the next round if we continue working on it. So it will be a bit left to it will be a bit of coincidence if something is done. Yeah. Veronica, do you want to say something about international cooperation? You don't
Well,
have to.
not really. From what I said, for when it comes to the strategies external action part, it really only focused on Ukraine and slightly mentioned other plans that I just presented. So unfortunately, I personally think that's kind of a missing part of the strategy, that it's really good that it focuses on the reconstruction of Ukraine. But for the other question, it doesn't really mention intersectionality, even in Ukraine when it comes to women or women shelters. So I don't think there's anything else that I would add. You really summed it up, Florian.
Okay. Are there any other questions?
We have a hand by Katarina.
Okay. Yeah, she may take the floor.
Hello, do you hear me?
Yes, we do.
Okay, greetings from Croatia, and one question. Does in Europe, in every country, exist living communities for people with disability? So like flats, social flats, or social buildings. I think Antonella or Veronica mentioned about it. Thank you for giving chance to ask you.
We're talking about centers for independent living. Is that correct?
No, I think she mean social housing.
Sorry.
It's not true. I think it's about housing.
Yes, I think it's for Veronica
Yes.
for social housing.
Veronica,
Yes.
how are we doing on social housing?
Sorry, we have technical issues here from Brussels. Could you please repeat? We had no audio.
Okay, there was a question to which extent EU countries have social housing.
Oh, that was for me.
Yes.
So the EU recently launched this EU Affordable Housing Plan, and they started working on housing in general in the housing crisis. So this plan has a second part, which is the Affordable Housing Act, that it's not out yet. So we don't know for sure how the EU is going to introduce when it comes to social housing. We're still waiting for the act part of this, but when it comes to disability rights, we are trying to advocate for accessibility and universal design, and also when it comes to social housing, to make sure that those social housing also accessible. There are some really good examples all over Europe. For example, in Paris, there's this idea that every new build or renovated housing should have like 10% of social housing. There are really good examples for this and researches, but so far it's just one or two examples in all over Europe, but it doesn't really picked up by the European Union. So we don't know yet, and hopefully it's going to be as inclusive and as accessible as it could be, but we are working on it right now.
Thanks,
Thank you
Veronica.
very much.
You're welcome.
Okay, Gafsa has raised her hand. You can take the floor, Gafsa.
Yes. Hi, Hafsa Carlson from South Africa. It seems it's a global problem now, including Europe, that there's a lack of infrastructure, health infrastructure there's a lack of work opportunities. There is a lack of protection of disabled people. Their safety is not a priority at the moment. The funding of governments is not coming on board. So it leaves your organization in quite a difficult state. Yeah, because all that needs is identified, and domestic violence against disabled people, it has high flags now in Europe also. So we need to look at that aspects also. The workplace safety, health access, the rights of disability, because disability laws is there, the CRPD laws is there, but the implementation is a major problem. So I just wanted to share that.
Mhm. We totally agree with you on the problems you named. We will from next year, as Emil, we will do more like on global action, do more global action for independent living. But we have to start now to figure out actually what other continents expect also from the European Union to be done. Like we don't want to come to you and pretend that we know what you want or need. So from next year, we will reach out to, well, independent living enthusiasts across the globe and have a dialogue. So you can tell us what you expect from the European Union to do. And then we will bring these demands to the European Union
Yeah.
and see what can be done.
Yeah, it's definitely to do with the policy formulations, definitely, and the implementation of these policies, how you are going to get that right. And the advocacy falls under that also. So that is what you have to look at the moment, the way I see it. But I will contact you privately by email.
Okay,
Is that okay?
that's okay. Very much so.
Yeah. Okay. What country are you now?
We are in Belgium, most of us.
Oh,
Okay.
oh, okay. Merci beaucoup.
Using the-
Okay, au revoir.
Okay. There's a question in the chat which is about AI. How can AI be used to make cities more accessible? From Matteo. But Kamil already left, our AI expert. So I'm not sure if anyone has a take on this. We may ask Kamil and provide the information later if he has an assessment. Okay, I'm also seeing we are 30 minutes over time, so we don't want to do take. I don't want to do this.
I think Sophia wants to reply the question.
Okay, Sophia.
I'm going to try. So something that could be used to make cities more accessible is, for example, using sensors, for example, in the streets. Like you can connect traffic lights with technology to then indicate, for example, in an app where it would be blue or where it would be green or red. So to indicate when a person could cross the street, this could be a possibility. So there's a lot of technologies like this that could help make cities more accessible. And obviously we need more input of disabled people to create technologies like these, for example.
Input from disabled people is always good. Always a good approach. Okay, I would say since we're 15 minutes over time now, I would say we don't take much bother you more. Here, in case, so this recording, it will be available online. Zoom is annoying me a lot today. So here are all our email addresses. Here. Yeah, thank you for joining. We hope you have enjoyed our policy briefing. Everything will be available on YouTube. Yeah, okay. Thank you for joining and have a nice rest of the day.